So I check her motion, and she has major loss of flexion. She can't even, before the previous visit, able to touch her toes. And now she can't even get to her knees. She has major loss of side glide torts. But she has no thigh pain. Her thigh and buttock pain has been gone. And her toe tingling is gone. Right? So in my mind, okay, she's definitely worse. And there's two options here, right? Option one, she either went lateral on us, or number two, she switched and she went flexion. I mean, given the large loss of lateral and the prevalence of lateral, I was like, oh, maybe we need to look at lateral here. I mean, she had a lateral component, right? She had asymmetrical symptoms, unilateral symptoms. But the question is, was the lateral component relevant for her or not? Mm-hmm. So, and we wanted to take a look at lateral. And again, I guess the question for all of us, just to remind ourselves, when do we go lateral? And we go lateral when we exhaust the sagittal plane. Right now, everybody's heard this term, exhaust the sagittal plane, we go lateral. But what exactly does that statement mean? Like, exhaust the sagittal plane, it sounds so fancy, sounds so nice, it makes my heart warm. But what does that mean in terms of exhausting the sagittal plane? And I think there's two scenarios. Scenario one, right, all sagittal forces, given the appropriate force progressions, regressions, and alternatives, create a worsening response. So this is like your lateral shift. They come in, extend them down the leg, flex them down the leg. You do all the force alternatives. They get worse. Okay, you go lateral. That's scenario number one. You exhausted the sagittal plane. Scenario number two is there's initial improvement with sagittal loading, and then further progress plateaus. And if I further force progressions, it's no further benefit, or in some cases causes a worsening response. And this is kind of her definition, right? Initial improvement, 95%, plateaus. Last visit, we were really trying to push on her. She's plateaued. Further force progressions have no further benefit, and sometimes creates a worsening response. And this was her definition. So, okay, let's go lateral first before we look at flexion. And in terms of prevalence as well, that there's more likely she's going to be lateral than flexion.
Month after month, new guest experts sharing actual patient cases and subscribers sharing their own challenging and interesting cases. Check out Case Conversations at mechanicalcareforum.com.